of those markers that we often check in our practice is called high sensitivity CRP. And the CRP stands for C-reactive protein. What this tells us is that there are elevated levels of inflammation in the body. Now, there can be some transient acute reasons for this to be elevated, such as in cases of certain infections and other inflammatory conditions or autoimmune conditions. But when we're talking about CRP elevation in the context of metabolic health, we really see that this marker can be elevated for prolonged periods of time in people and really more related to weight and this metabolic dysfunction. So what's really interesting with these medications, we've observed that over time and often correlated with weight loss, we're also seeing this reduction in the CRP. Why is this important? Why does this matter? Why are we tracking this thing? Because CRP or C-reactive protein is a marker of cardiovascular risk as well. So this is something that we take into account when we look at a lipid profile of an individual and when we are risk stratifying them and we're trying to assess how great of a risk do they have when it comes to atherosclerosis or plaque formation or inflammation of the lining of their blood vessels.